After hospitals were hit with a double whammy of RSV and flu cases, they're finally seeing it ease up. But now doctors are warning of an uptick in influenza B.
Grace Hodek has you covered on what they're already seeing and expect moving forward.
The past spike in RSV and flu was what doctors were calling a twin-demic. Cases were overwhelming hospitals across the country and in Wisconsin, leading health officials to sound the alarms.
It's not over yet. Some years it is over, but most years there's going to be this later wave that comes. And so we continue offering flu vaccine.
Now, cases might be down, but doctors like Jim Conway at UW Health say they aren't letting their guards down, and neither should you.
Most years, this sort of B wave that kind of comes up usually in March and April. So we're sort of looking at the horizon thinking that if it's going to happen, it's probably going to be happening in the next few weeks.
Conway says they don't fully know what to expect. He says with how many vulnerable people in the community there are, plus more social activity, that could equate to as big as a peak they saw with influenza A.
There's enough of what we call immunologic naivete that people just haven't been exposed to these things now for a number of years, and our vaccine rates are unfortunately a little bit lower than they usually are.
Doctors say symptoms of influenza B are more than just the common cold.
Cough, sore throat, fever, body acheness, headache. Those are the general, along with fatigue.
They'll keep people out of work for at least a couple of days. For people that have underlying medical conditions, they can certainly set things off.
To protect yourself and others, doctors advise to do what we've been doing: staying home when you feel sick, wearing a mask, and washing your hands. In Madison, Grace Hodek, 27 News.
Influenza B cases are generally less common than influenza A, but it can be more serious in younger children. It also circulates a little longer each year.